This is Kathleen Schaum speaking, and I am so excited to give you some great news. This is great news for our Medicare patients who could benefit from topical oxygen therapy. Now, I want to tell you that there's been a few pieces of misinformation circulating around the internet ever since this was released a few days ago. So I'm going to try to clarify a couple things right up front. Number one, this news did not come from CMS. It came from the MACs, all right? And it is not giving positive coverage topical oxygen therapy today. It is a proposed LCD, which will give positive coverage to topical oxygen therapy in the future. So most importantly, listen to what I'm going to tell you. You now have the unbelievable opportunity to comment on this LCD, to make any suggestions for refinements or clarifications so that when it does come out, not only do the patients get very good therapy, but we also understand exactly what we have to do, our documentation, diagnostic testing, etc. So let me just give you a quick overview of exactly what is going on. Currently, CGS and Noridian, who are the two durable medical equipment Medicare administrative contractors that are known as the DME MACs, they have an active LCD for oxygen and oxygen equipment. And that LCD has been in place for many years, and it includes all kinds of oxygen equipment. Now, the LCD number for that is 33797. And unfortunately, in that LCD, which is active today, there are two statements which prevent Medicare beneficiaries from receiving topical oxygen therapy treatments. Now, those two statements are topical hyperbaric oxygen chambers with a HCPCS code of A4575 will be denied as not reasonable and necessary. And the second statement is topical oxygen delivery systems with a HCPCS code of EO446 will be denied as not reasonable and necessary. So that's why topical oxygen therapy has not been able to be delivered and covered for our Medicare patients. And about 5 years ago, a local coverage determination reconsideration request was submitted. And the reason was to gain positive coverage for the use of topical oxygen therapy for the treatment of diabetic foot ulcers. But in this 5-year period of time, the DME MACs did not on that request until this week. Now, many people have intervened and talked to the DME MACs during that time, wondering why that reconsideration request has not been turned in to a proposed LCD. But at this point, it doesn't matter because without fanfare, July 23rd, CGS and Noridian released a proposed LCD for comment. And it is still entitled Oxygen and Oxygen Equipment. It is labeled with the same number, but a DL in front of it. So it's DL3797. And the link to the proposed LCD will be shown on your screen. Now, this proposed LCD removes those two statements, and it includes an entire section that proposes reasonable and necessary positive coverage for topical oxygen therapy for Medicare beneficiaries with diabetic foot ulcers that have failed to heal with 4 consecutive weeks of optimized diabetic foot ulcer care. So that is very exciting, meaning that the DME MACs now do want to cover it. Now, when we get a proposed LCD, there are a variety of sections in the LCD, and those sections are ones that you want to read very carefully because words matter. And if there are some words in there or some requirements that either need to be refined or clarified, this is your opportunity to do that. Now, there are actually 11 components in this LCD that I want to bring to your attention. And that's why it's very important for you to read the entire thing. The first component is it gives a detailed coverage guidance for the initial first month or continued topical oxygen therapy beyond the first month and when the coverage ends. The second thing is it talks about exclusion from coverage. The third, it gives a summary of the evidence that was used to create the proposed LCD. And it gives a very thorough literature analysis, including literature analysis table that you would be able to read so that you can see all the studies have been included. The fifth thing is they talk about the clinical guidelines, the agency reports, and the professional society positions that are regarding topical oxygen therapy that they also referred to when they created the proposed LCD. And then they also had a contractor advisory committee meeting, and the contractor advisory committee did an analysis of the evidence, and it includes that analysis of the CAP. Now, very important, it includes the documentation requirements that are outlined in 2 attached articles. So it's not only important to read the proposed LCD, but the attached articles. And of course, for all equipment, there is the standard documentation requirements that will get attached to every DME MACs LCD. And the second documentation document will be the coding and billing article, that will be specific to the proposed LCD. The 8th thing that it talks about and lists is the sources of all the information and a complete bibliography, everything that was used to create the proposed LCD. Then it lists if there are any HCPCS modifiers that should be used. Then it talks about the HCPCS code. And then the final thing is the attached articles. So once you have thoroughly read the proposed LCD and the attachments, you have 2 opportunities to provide your comments to the DME MACs. You will find explicit comment instructions on the websites of both CGS and Noridian. Now, your first opportunity to comment is on August 26, 12:30 p.m. You may present oral comments at a virtual meeting. The DME MACs websites provide instructions for registering to present or how to simply listen to the proceedings. If you plan to present, you should read the instructions soon because the registration deadline for telling them that you want to present is August 5th at 5:00 p.m. Now, you may also submit written comments electronically no later than September 5th. Now, your comments should be very specific and they should offer suggestions to address any of your concerns. They should be supported with evidence-based rationale, and you should attach the full content, any text reference that is not already included in the bibliography of the proposed LCD. Now, please note the DME MACs encourage you to submit a written response regardless of your agreement or disagreement with the proposed LCD. They want to hear from all stakeholders. Remember, this is a proposed LCD. It's not yet implemented. Therefore, you should not make any changes to your practice right now until the DME MACs review all the comments and they make revisions that they deem necessary. Then they will release a future effective LCD, which will give you time to implement the coverage, coding, and documentation guidelines before the LCD becomes active. Now, before I leave, I want to encourage you to read the proposed LCD and the attached articles in their entirety. Then plan to present at the virtual meeting and or to submit your positive or negative comments with suggestions. Now is the time to make your voice heard. Once the LCD becomes active, you will have to accept and implement the guidelines. Now, this tentative positive coverage is great news for topical oxygen therapy, but it is up to you to inform CGS and Noridian the guidelines are correct and reasonable. And remember, words matter in the LCD. Don't miss this opportunity to influence the coverage and documentation guidelines for topical oxygen therapy for your Medicare beneficiaries. And thank you very much for listening.